You will direct the healthcare providers seen on the screen by selecting Actions and Interventions from the tabs on the lower part of the screen. Each tab represents a category of actions and tests that you can use to evaluate the child and intervene appropriately. The first tab, labeled Response, lets you check the child's responsiveness and ask the parent questions. The Airway, Breathing, and Circulation tabs each contain actions related to these specific areas. In the Airway tab, you'll find actions such as performing a head tilt, chin lift, or inserting an advanced airway. In the Breathing tab, you can attach a pulse oximeter or ventilate the child. And in the Circulation tab, you can start and stop CPR or use a defibrillator. The Examine and Vital Signs tab contains options such as performing a head-to-toe exam of the child and checking the child's vital signs. The Drugs and Manage IV/IO tab gives you options to establish IV and IO access and administer fluids and medications. On the Test and Diagnostics tab, you can request blood tests and order an X-ray. On the Miscellaneous tab, you'll find general actions such as changing the child's position, for example, from lying supine to sitting. This tab also gives you access to the 2010 Handbook of Emergency Cardiovascular Care for healthcare providers. Clicking the Open Handbook button pauses the scenario and allows you time to read and review the steps of pediatric life support. You are then able to resume the scenario by clicking on any action. To intervene for the child, simply click the actions you think are appropriate interventions, and then evaluate the child's response. In each case, you should select the actions you think are appropriate for the child's clinical condition. After each intervention, you should re-evaluate the child's condition and obtain feedback from other members of the healthcare team. Each tab has a menu of action buttons, which allow you to direct providers' actions. Circular buttons perform actions, and triangular buttons open submenus of related actions. For instance, to use the defibrillator, you click on the triangular button labeled ECG and Defibrillator. This opens a submenu where you will find the defibrillator and buttons for related actions. The buttons to operate the defibrillator are on the device, and other actions, such as attach pads and stand clear, are located to the right of the defibrillator. Remember, the triangular button doesn't perform an action itself. It simply opens a submenu of related actions. When you click the circular buttons, the providers will start performing the chosen actions. Some actions, such as performing CPR, will run continuously until you choose to stop them. If you are performing CPR, when you click the circular CPR button again, or the circular Stand Clear button in the ECG and Defibrillator submenu, CPR, both compressions and ventilation, will stop. To resume CPR or ventilation, you will need to click the appropriate circular button again. Notice that the buttons Start CPR 15 to 2 and Start CPR 30 to 2 means that both compressions and ventilations will be given in a 15 to 2 or 30 to 2 ratio. So you should not count compressions and stop to give ventilations when using these actions. You will, however, need to set the oxygen rate using the slider next to the buttons. The use of the length-based tape action is required in several scenarios. The tape contains valuable information about drug doses, equipment sizes, including sizes for advanced airways, and energy levels for defibrillation. Once a child's weight has been estimated by using the length-based tape, drug doses and equipment sizes will be displayed in the upper right corner when appropriate. The screen shows two timers, located below the child's close-up in the upper right corner of the screen. The top timer is labeled Scenario Time and shows how much time you have spent evaluating and intervening for the child. Buttons next to the scenario time allow you to pause and to fast forward the simulation. Pausing can be very useful if you are having trouble locating a specific action. Pausing the simulation gives you time to look for your next action without using scenario time. Once you click the action, the simulation will resume. The fast forwarding will automatically advance the case simulation by 60 seconds. The fast forwarding will automatically stop when there is a change in the child's condition, such as the completion of an IV fluid bolus or availability of lab results. Under the scenario time, you'll see the code clock. This is a stopwatch to time CPR cycles or drug administrations. The code clock blinks red every 2 minutes as a reminder. Click the first button to start the code clock and the second one to reset it. In the lower right corner of the screen are 3 buttons. The call code button activates the emergency response system. The medical record button opens the child's file and allows you to see a summary of the scenario and the actions taken. This record is divided into tabbed sections that also include laboratory and chest X-ray results. The third button is the Transfer Patient button. Once you have provided the appropriate interventions according to the PALS guidelines, click the Transfer Patient button. A menu of patient transfer options will appear. Select the option you think is the most appropriate to end the scenario. At the end of the scenario, you will be taken to the debriefing. On the right side of the screen, a detailed summary is presented of how you managed the case and whether you passed or failed. To the left of the screen, the 5 main areas of critique of your performance are shown. As you scroll over the elements in this list, they will also be highlighted in the detailed view so you can see each element in context. Please take the time to review the summary thoroughly. If you have trouble passing a specific case, you can consult your PALS provider manual by clicking one of the book links on the right side of the screen. You might also benefit from watching one or more of the AHA PALS videos or one of the extended tutorials, which are all accessible from the program's